Welcome back to the HHS department. We are talking MAHA with the leaders of the health movement at HHS. Mr. Secretary, estimated 129 million people in the U.S. have at least one major chronic disease. 5 of the top 10 leading causes of death in the U.S. are or strongly associated with chronic diseases. If you go down these stats, as we put them up, we're not healthy as a country. 100 days in, do we have a sense more of why that is?
We're about to publish the MAHA Commission report, and that comes out next week, and that will summarize and distill the science that we have that points to causation. And in many, many cases, we know what the cause is: too much sugar, too much starch, ultra-processed foods. When my uncle was president and I was a 10-year-old boy, Brent, the chronic disease rate in our country was 3%. Today, it's around 60% in kids. Juvenile diabetes was practically unknown. Today, 38% of American teens are diabetic or pre-diabetic. Autism in 1970 was the most comprehensive and largest epidemiological study ever done, was done in this country to determine precisely how many kids had autism. At that time, it was less than 1 in 10,000. Today, CDC's data that we released last week, 1 in 31. In California, it's 1 in every 20 children, 1 in every 12.5 boys. This is 1,000 times worse than COVID, this epidemic. And nobody's done anything to adjust, even to try to identify what the etiology, what the causes are. We're doing that. Jay is doing that now. We will know these answers very quickly.
How soon do you think?
Well,
because that's a big thing for a lot of parents.
We will have definitive answers within a year, but we will have very good answers within 6 months, by September. So we'll have preliminary answers by then from some of these early studies. We will have definitive answers within a year, but some of the stuff we don't need any more science. We don't need more commissions. We don't need more study groups. We need to act. We need to reduce the amount of sugar in our food. We need to reduce the amount of chemicals. We've already ordered that all the dyes, the 9 petroleum-based synthetic dyes, we're getting rid of within 2 years. The worst 2 within 2 months. So we're acting in this administration, and we're going to identify the things that we can't get rid of. We're going to label so that when you go into the grocery store to buy food for your children, you know what you're giving them, and you know whether it's going to be good for them or whether it's a food-like substance that is loaded with lab-created chemicals that's going to poison your children.
All of you have now been in the belly of the beast now for a little bit.